Hi, my name is Kate and welcome to our channel. Today we're going to have a conversation with Dr. Greene, clinical psychologist, New York Times bestselling author, originator of the collaborative and proactive solutions model, which is addressing challenging behavior of children but in a different way that many of us get used to. He's working with families and children for more than 30 years applying his approach, so we're going to make a deep dive into practical aspect of his model and work. If you will enjoy the conversation, please don't forget to like the video and subscribe to our channel. Ross, thank you very much for joining the conversation today. And the first what I wanted us to start with is, could you explain to the audience a little bit more what is the collaborative and proactive solution model? What we are talking about?
What we're talking about is collaborating with kids proactively on solving the problems that are affecting their lives. Mm-hmm. That is different from what a lot of caregivers do, because a lot of caregivers are more focused on a kid's concerning behaviors and trying to modify them, often through rewarding and punishing kids. But rewarding and punishing kids to modify their behavior doesn't solve any of the problems that are causing those behaviors. And so this is a problem-solving model, not a behavior modification model. Here's the thing for everybody to know. It's only unsolved problems that cause concerning behaviors. Solved problems don't. So once the problem is solved, the concerning behavior subsides. So I guess my mentality is this. You can modify the behavior if you want to, but the problems that are causing that behavior are going to remain unsolved. If you solve the problems that are causing that behavior, you get a 2-for-1 sale. The problem is getting solved, and the behaviors that are being caused by those problems subside.
When you're talking about problems, what type of problems are they? What are the problems that kids have?
Well, we call them unsolved problems, and the synonym is unmet expectation. So any expectation a kid is having difficulty reliably meeting is an unsolved problem. At home, that could be things as mundane as difficulty brushing teeth before going to bed at night, difficulty getting off the Xbox to come in for dinner, difficulty waking up to go to school at 6:30 a.m. on weekdays. At school, that could be things like difficulty coming back into the classroom after recess, difficulty completing the double-digit division problems on the worksheet in math, difficulty coming to school. Those are all what we would call unsolved problems, all expectations some kids have difficulty meeting. And kids who are prone to concerning behavior are going to communicate that they're having difficulty meeting those expectations through their concerning behavior. In that respect, the concerning behavior is just the frustration response, just the stress response, just the means by which the kid is communicating that there's an expectation they're having difficulty meeting.
And when we're talking about kids, do we talking about the specific age group or this concern, like unresolved problems for them? Is any type of problems from, let's say, 2 months old being unable to self-regulate because mom is not over there, or a teenager who is let's say use drugs, for example, which could be also some sort of stress response?
Why start at 2 months? Even newborns have expectations they're having difficulty meeting. Even newborns have problems that need to be solved. And we do collaborate with newborns, believe it or not. We do try to figure out what's getting in their way. We do try to apply a solution that we think will work, and then we are 100% dependent on the infant to let us know how we did. And if we didn't get it right, the infant's going to let us know. As kids develop language processing skills in particular, we can engage them much more directly in the problem-solving process, but that means that a lot of kids can participate in the problem-solving process by the time they're 1.5 to 2.5 years old, and we should never look back.
So when we talk about the unsolved problems, this is not the response like, let's say my child is screaming because he's upset with something. This is not his problem. The problem is something different, like we were trying to go out and he couldn't put like whatever. He was not in a hurry, I was in a hurry. And that was the unsolved problem. That was my expectation that I had, which he cannot comply with, right?
That is correct.
Got it. Okay.
And so in this model, we don't talk about compliance. We talk about collaboration.
And that's my next question. So why, and you talk about this a lot in your books and in your work, why is it important to shift the perspective that many of us parents and caregivers and probably teachers at schools still have from this compliance to collaboration? Why is it important?
Well, for two reasons. Number one, some kids aren't going to be able to comply. It's an expectation they're having difficulty meeting. If we insist on compliance, we're just going to make things worse. We need to find out what's getting in the kid's way. We need to engage the kid in the problem-solving process so the problem can finally get solved. Insisting on compliance doesn't accomplish that. But even more so, people have been doing a lot of stuff to kids for a very long time that is actually very harmful in the name of getting kids to comply. Compliance has caused a lot of harm. And what's interesting is when people start thinking about collaborating with a kid, they immediately worry that this is some passive, liberal, namby-pamby, progressive. No, this is about working with kids to solve the problems that are causing their concerning behavior. You're not saying that their concerning behavior is acceptable. You're not saying that their concerning behavior is okay. Their concerning behavior is still not okay. It's still not acceptable. But we're finally now doing something that's actually going to be productive to try to do something about the concerning behavior.
Any behavior that communicates that a kid is having difficulty meeting an expectation. I'm not picky about what qualifies as concerning. Plus, different caregivers are more bothered by some behaviors than by others, right? So we're not picky about what counts as concerning. Any behavior that communicates that a kid is having difficulty meeting a particular expectation counts. That could range from whining, pouting, sulking, withdrawing, crying, to screaming, swearing, hitting, spitting, kicking, biting, throwing, destroying, running. They're all concerning. They're all communicating the exact same thing. Expectation management is where we are trying very hard to make sure that the expectations we are placing on a kid are expectations they can actually meet. We've already established that it's unmet expectations that cause concerning behavior. So if we're placing expectations on a kid that we know they're not going to meet, then we are, even with the best of intentions, causing concerning behavior. So one of the things I'm always encouraging caregivers to do is take a step back and ask themselves, can my kid actually meet that expectation reliably? Not can other fourth graders, not what about other 12-year-olds? Can my kid, can this kid meet this expectation reliably? If not, then I'm going to ask why you're putting that expectation on that kid. Because all you're doing is causing concerning behavior and not coming 1 centimeter closer to solving the problem. So what I often say is, I think that if us adults were doing better expectation management, we'd be doing a whole lot less behavior management. So that's a very important point to get through here. Some caregivers sometimes think that what I just said is, I don't know where they come up with this because it's not what I say. So that means removing all expectations. Who said that? That means making sure that the expectations you're placing on a kid are in range for that kid. The next question people usually have is, how do I know? The answer is, it's a judgment call. But here's a very imperfect algorithm to help out. If the kid can sometimes meet the expectation, it's probably in range. If the kid can never meet the expectation, it's probably out of range, and I would proceed accordingly. Expectation management, an idea whose time has come